Good morning. As you heard, my name is Zoe Harris. I'm the founder of Mycarematters, and I'm asking for your support today for the development of a significant addition to Mycarematters, an Advance Care Planning Toolkit. I'd like to start by telling you a little bit about what Mycarematters is and how I came to be doing this work. My late husband Jeff had dementia. I cared for him at home for about 5 years. He had to move to a care home for what turned out to be the final 13 months of his life. Before that, he'd experienced overnight stays in hospital, we'd experimented with respite care, and he had a 3-month stay in an assessment ward. In all of those care settings, I saw how ignorance of somebody's needs and preferences, when they are unable to communicate those things to themselves, resulted in some really dreadful outcomes. So, for example, in the respite care home, the message hadn't got through to carers that Jeff drank his tea black. It resulted in him becoming severely dehydrated, and as a result of that, he effectively lost the ability to walk across the space of that one weekend. So I developed a very simple wall chart to ensure that everybody interacting with Jeff was aware of the things that he'd been talking about if he'd been able. And variations of that original chart have gone on to be adopted by over 1,200 care homes throughout the UK. When hospitals showed interest, I realised that their challenge was that their need was just as great for a tool like this. There are paper tools attempting to address the problem, but they all have shortcomings of one form or another. So I developed Mycarematters, a service where somebody can, or someone on their behalf, can create a short profile of the information they want healthcare professionals to know about them, in the event they can't communicate those things for themselves. Whether they use the online tool or they fill in the paper tool that we also provide, we ask hospitals to display it behind the bed so that it's available to everybody interacting with the individual. It was when I was working with a trust in Cambridgeshire that I came to see how Mycarematters could be used as a way to start that conversation about what a person with dementia might like to have happen as they approach their end of life. The trust wanted to have more people create advance care plans because research shows that when people have recorded and thought about and recorded their preferences for end of life, incidences of hospitalisation are reduced. But the feedback from staff was that they were struggling to have those conversations, that they were unsure of the legal status of some of the legal documentation, and just didn't really know what it was they should be encouraging people to do. So we want to develop an advanced care planning toolkit to help people, to inform people of the decisions that are available to them, to give them a framework for the process, using Mycarematters, creating a Mycarematters profile as a way to initiate that conversation, providing case studies and examples, helping them define their goals, and then to record and share that information that's going to provide peace of mind and a better experience as people reach their final stage of life. We'd start off by interviewing carers and people living with dementia, add that to the information we've already gained from healthcare professionals. We'll then work up some draft designs and take them back to those original interviewees, as well as putting them in front of a whole cross-section of health and social care professionals. We'll end up with a set of documents and tools that will enable people to create an advanced care plan that then can, if they wish, be uploaded to their Mycarematters profile, which can then be accessed from any care setting. People helping me on the project are our medical director, Crawley GP, Dr. Richard Howarth, who's got a special interest in palliative care, design strategist Ruby Steele from Big Life Fix, if you're familiar with that programme. We're also working with West Sussex Carers Support West Sussex and other carers organisations, and Kath will be helping us to engage with the online communities that we have close ties with, particularly on Twitter. If we're successful today, where the money is going to be spent is on that data collection and analysis, on then the design and the printing of a paper version of the toolkit. So Mycarematters is all about patient engagement, encouraging people to take an active role in their care. This toolkit will endorse that approach and take it still further, helping people to take control of their future care, having a say in where and how they're cared for. So those wishes can still be taken into account when they may no longer be able to speak for themselves. Thank you for listening, and I welcome your questions.
Thank you very much.
Bang
So thank you very much for taking us through that so helpfully and bang on time with something. So clearly it's an area of work you've been working on over some time, and